A vague BIRP note is the fastest way to lose a claim at audit, because if it was not documented, it did not happen. Discussed feelings is not a documented intervention, and a payer reviewing your chart will treat it like nothing happened. BIRP is popular in community mental health because it clearly links what was wrong, what you did, and whether it helped, exactly what payers want to see. We will break down the 4 parts of a BIRP note, walk through a real example, and show the mistakes that flag audits. So, what is a BIRP note? BIRP stands for Behavior, Intervention, Response, and Plan, a 4-part progress note format used across behavioral health. It clearly links the client's presentation to what you did and how they responded, in that order. That structure makes BIRP especially good at demonstrating medical necessity, which is why community mental health programs lean on it. Here is where a weak note gets expensive. Document a 60-minute session in a 30-minute time slot, and that timing mismatch flags the claim on review. Documentation details that do not match your billing codes are a common reason an insurance company denies the claim. This is where a generic EHR falls short. A generic system hands the clinician a blank text box and hopes the 4 BIRP elements end up in it. Behave Health is designed to support structured templates built around SOAP, DAP, and BRIP, with the fields guiding you through every section. A BIRP note has 4 parts. Let us walk through all 4 with a real example. Behavior, Intervention, Response, and Plan. Each one carries part of the clinical story. Part 1. Behavior, what you saw and what the client reported. Record presentation and the client's own words. For example, a client arriving visibly distressed and saying, "I can't handle this anymore." Stick to observations, not interpretations. Direct quotes carry more weight than a label like difficult. Part 2. Intervention, the specific technique you used. Document the actual method, motivational interviewing to explore ambivalence, teaching boundary setting, a role play for practice. Naming the intervention is what proves active treatment happened. Discussed feelings does not. Part 3. Response. How the client reacted to the intervention. Capture the reaction. For example, initially resistant, then more engaged during role play, ending with "I can see how boundaries might help." Pairing intervention with response is how the note demonstrates progress toward the treatment plan goal. Part 4. Plan. What comes next? Spell out next steps. Try 1 boundary conversation this week. Journal about it. Continue weekly sessions on communication. Always connect the plan back to a treatment plan goal so the note supports continued authorization. Auditors look for specific problems. These are the ones that flag a BIRP note. Copy-pasted entries across sessions are a primary red flag. Every note must reflect the actual encounter. Naming the technique matters. Discussed feelings reads as no intervention at all. If a client mentions suicidal thoughts, abuse, or relapse, documented. If it is not documented, it legally did not happen. A note with no connection to a treatment plan goal cannot demonstrate progress or support continued authorization. A few habits separate a defensible BIRP note from a risky one. Finish the note within 24 to 48 hours while the session is fresh and details are accurate. Aim for 150 to 400 words, enough that another clinician could pick up the case. Use person-first language, like "person with a substance use disorder," rather than a label, since the client may read the note. This is where the right platform changes documentation. Behave Health is designed to support BIRP templates at the point of care. Click New Note, and the behavior, intervention, response, and plan fields are already waiting. No remembering the structure. Golden Thread technology pulls active diagnoses, treatment goals, and medications into the note, so the link to the plan is right there. The system scans for timing inconsistencies, blank required fields, and codes that do not match before you submit, not after a denial. It is designed to support HIPAA and 42 CFR Part 2 requirements directly, with audit trails and role-based access. Stop losing claims to vague notes. Build every BIRP note right at the point of care. See BIRP, SOAP, and DAP templates built into your workflow. Book a 20-minute demo at behavehealth.com.